Muy bien.
Okay, we will begin now. We will begin. We're going to start. We will begin this session, this presentation. I would like to welcome you all, ladies and gentlemen. Good morning, good afternoon, and good night. We have participants registered in different countries in the world, and I wanted to give you our warmest greetings. We are now launching this atlas of vulnerabilities in developing countries which are fighting against a pandemic, focusing mostly on countries in Latin America and the Caribbean. First of all, I'd like to introduce myself. My name is Patricia Miranda. I am the head of Incidencia Global and the Latin American Network for Economic and Social Justice in LATINDADD. I would like to begin as well, giving you technical information. We have translation in the languages of English, Spanish, and Portuguese. On the bottom right side of your screen, you're going to find an icon that is a globe. And you can select there the language that is better for you. We also have the function of questions and answers. So you can write your answers or questions and send it to us in written form, and we will then organize them and send them to the different panelists. And last but not least, we are transmitting this live by Facebook Live in LATINDADD. You can also watch this presentation from there, but you're going to have to listen to everything in the original audio. But you can also ask your questions there. Again, I would like to give you the warmest welcome to everyone, ladies and gentlemen. We are very happy on behalf of LATINDADD and our sister organization, Jubileo USA, whom we have worked with for almost a year in putting together this map. I would like to tell you what our motivation was to decide to take on this initiative, amongst which we saw that there were policies of contention against the crisis that simply did not reach the developing countries. In the case of Latin America and the Caribbean, the most of these countries are medium-income countries.
Las evaluaciones ya mostraban las
The evaluations have already shown the inequalities in our cooperation between the several different countries. In the same way, several international organizations qualified Latin America as a region that was already in a different decade, and we've seen a measure and the GPD. This is something that we have already seen in a long history from the different stakeholders, that the per capita is hiding a series of economic vulnerabilities in our countries, factors that are limiting our capacity for reaction and resilience, as we can see now in the screen. We have had several calls ever since the beginning of the crisis for policies that are going to be including other countries for global recovery. The Andthe and the Monetary Fund have mentioned next policies that are going to be taking into account the vulnerabilities that the different developing countries have. But what are these vulnerabilities? Well, we're going to be introducing them here today in the case of the Latin American countries and the Caribbean. Our main goal is to identify what our vulnerabilities are and to reflect on how we are finding our countries where we're at and the restricted capacity for response that we have against the crisis that we now are facing. We have worked with a multidisciplinary team from several different countries in the region. We have consulted global sources, regional sources, national sources, and we have also consulted different specialists for the sector to be able to identify these indicators. Today, we have the presentation for your use and for you to be able to explore and download your data, to be able to look at the countries and to compare the situation with other countries. We want this to be useful for the global policies and national policies, and also different campaigns. And, well, if there is this space for this to be an example or for this to be an interest of other regional activities, because we know that other countries are also going through the same situation as Latin America. Apart from that, it also allows us to identify the enormous gaps compared with what we are presenting and these indicators with the situation of the developing countries, the developed countries, as we're going to be able to see in the next few moments in the presentations. So we have the honor of having a specialist panel, distinguished panel, that is going to be giving us their knowledge, analysis about the vulnerabilities in Latin America and the Caribbean,
Preámbulos, voy a
and
presentar.
also from different angles. I'm going to be introducing the panel that is accompanying us today. Daniela Berbeja, Regional Responsibility for Vulnerability in LATINDAD, a specialist in quantitative methods for economic analysis. Daniela was an investigator for this. Welcome, Daniela. We also have Aldo Cagliari, Senior Director of Policies and Campaigns for the United States. Previously, Aldo was Senior Director of G24. We have the pleasure of having Daniel Fitterman with us. He is the Director of the Division for Economic Development in the Economic Commission of the United Nations for Latin America. And Daniel was also a coordinator of the special studies of the same organization. We are sad to say that we cannot have Vinicius Carvalho Pineiro with us today, the regional director of the ID Latin America and the Caribbean, but we have the enormous pleasure to have the presence of Roxana Mauricio. She is a regional specialist in working economy, Latin America and the Caribbean. Welcome, Roxana. We also have Camilo Cid. He is an officer of social issues in the Office for Social Development. He was also regional advisor of the economy of health and financing in the Pan American Organization of Health. It's a pleasure to have you with us here today, Camilo. And last but not least, I have the pleasure of introducing Ley. He is Officer of Economic Issues in the Natural Resources Area, the Subregional Department of CEPAL. He is part of the fourth chapter of the social support of the panel, Intergovernmental Policies for the Climate Change. Thank you very much, Deborah, for being with us and for accepting this invitation in replacement of Derek Solimano, who, because of a family problem, was not able to be with us today. So, having introduced to this distinguished panel of specialists and experts, I also want to highlight that we are very happy to be with CEPAL here and all of these knowledges in this space, and also to tell you from civil society, we are also accompanied in all the policies and everything that is being presented in this very important role that you have in the region. Okay, so without further ado, I would like us to begin to look at the map, what it's about, what information we have. It is an interactive map, and well, I'm also going to be inviting Daniela Berbeja from LATINDAD to present the map, the findings, and the main recommendations that we're seeing in the region. Daniela, please go ahead. Thank you very much, Patricia. It is truly a pleasure to be sharing this panel with Daniel, Camilo, Roxana, Deborah, and of course with Ronaldo. We are going to be sharing our screen now. And well, we're going to make a small, brief introduction. Patricia has already mentioned about the motivation for this project, and if then we could go to exploration of the map. Pandemic in these developing countries, in the specific case of Latin America and the Caribbean. The pandemic has shown us that there are a series of factors that are determining the capacity of the response that we have for developing countries against the pandemic. And the mobilization and what we are trying to do with this project is that we're trying to group together the factors that in many cases have made the way that we have been facing this crisis more difficult, not just in sanitary, but also economic, social, and environmental. And well, in a large part, our countries are considered middle-income countries. 19 of the 24 countries that are covered or cataloged as middle or high income countries. In this circumstance, is limiting the access to finance, which has been necessary for this pandemic, and also has left us with margin of the initiatives that we have found in this context for COVID in regards to the suspension and relief of debt. So we are in debt now, but in other terms, in regards to other countries. And the idea, as Patricia has also mentioned, is to transcend these measures of the middle income of the population or per capita. Because of which this map and this atlas is including economic, social, and climate factors that offer an image of the vulnerabilities in regards to multidimensional sectors. We have 12 dimensions that are grouping together about 55 different indicators. Even though we do have a cutoff date to prepare the database and the web page, as we get the information, updated information, this data is also going to be updated. For the case of the indicators that are pre-pandemic indicators, these are for us to be able to identify how we found these countries during the crisis, and also these are helping us to show the factors that are part of the recovery of the post-pandemic. Without further ado, I'd like to take you for the exploration. We have the opening page that we're going to be able to find. We have information about the project and the methodologies that we found. And we're going to be including a tutorial, findings, and apart from that, we're going to be including a brief.
Por dimensión también incluimos 3 estudios de caso que serían para Honduras, Perú y Paraguay.
These are going to be 3 case studies, including Paraguay, and we're going to be showing you the map. And what we have default, we have a first indicator that's already been selected on the top right. You can see tourism and economy, but the first action that you can take in the map is to put your arrow over the bubbles that are in the country. In the case of Peru, as you can see on the top part, we have the indicator that's been selected for values, and beneath that, we can see the charts that are independent of whatever indicator you've chosen. The first chart is going to be showing us 5 indicators where each country has most vulnerability, and this is compared to the other countries that have information regarding the indicators that have been placed. And in the second sheet, we're going to be finding some indicators related to debt and fiscal balances, tax balances. And then we have a second one, which is fixed for each country. The first one is going to be changing depending on the country. In the first case, for example, in Peru, we can see that we show more vulnerability in the exchange of the sampling, which has been important. The rate of mortality, one of our countries is one of the ones that are leading the world. In this indicator, we have the dependence on commodities, inequality, and the access to different infrastructure for health, private countries. In 2020, we have poverty, inequality, and in this way, we can also review, for example, El Salvador, and we can look at the context of each one of these countries. At the same time, we can also select on the right part one of the 12 dimensions and the indicators, the debt indicators that I've already talked to you about. Once we have chosen this dimension, we can choose between one group of indicators that belong to this section that is placed. We see here, I can go back to the values country by country, and if we place it on the bubble, what we're going to find is the value for the country that we are selecting here in Ecuador. And here we have the complete indicator. Next to this, we're going to be finding a reference value. To create this value is what's going to be helping us to be placed in the index in the context that we're observing. And this value is for the changes of the indicators. In this case, we can see for the OECD, we have about 3%. In the case of Ecuador, it is also 3% of everything that has been received. We also have a very brief explanation of why we consider these indicators as important as measures for vulnerability against this pandemic context. And one technical note with the data that we have been consulting on. Up here, you can see if we are going to be choosing, and perhaps we're going to be choosing tourism. I apologize. Or if we want to change countries, for example, we have Paraguay, or perhaps we have El Salvador, and then we can look at this same indicator in this way or in the same map. In the case of the income was 0.3% in the OMP, we can then see the data that we have in our countries and to look at how we're doing. And if there is an important dependence, there is also an importance in tourism. And on a world level, tourism is over 7% of importation. And in Latin American countries, it is above this value in almost all of the countries. Last but not least, I would like to say here we have country by country, and we can select and look at all of these indicators for this country that we have selected. We have El Salvador, for example. We can see what the indicators are for El Salvador. And here what we can do is look at the entire list, consult the values, all of the information about the full name of the indicator, the comparison values, relevance, and also the metadata. This is a bit more technical. Still, if we look at, for example, in this case, the dependence on external financing, I'm not entirely sure what this is about. And so what I can do is go to the right on the symbol of questions, interrogations. And what I can do is look at what the full name is. I'd like to go in and look at all of this data. It's very important for us. And last but not least, what I can choose is some indicators that I'm interested in looking at in the evolution in time. For example, I would like to look at inequality as one of the indicators where a lot of the countries are also showing a vulnerability, a significant vulnerability. And we can select this in the top right, and we have a chart here. Here, this is also giving us a better idea of the information that we have for each one of the indicators, because what we show in the map is the last available year for each one of the indicators that are chosen. For example, I could choose the indicators for those of us that have delay, for example, and we can make a comparison. At the same time, on the left, on the lower left, we can also look at the chart. And here I can look at if we have in Chile, we have the last year in 2017, and other years are shown here. And we have this chart with all of the data from the countries that we wanted to look at. We can download the Excel. And in this way, we can see everything. And amongst the indicators, I'd have to go back to the presentation. I'm going to try and look at this and give a quick overview on some of the findings that we have. I'm not going to go further into detail about this, but I know that the panelists that are with us are going to be looking at this. So I'm going to try to look at other dimensions or possibilities. And here I am now choosing what we are seeing on the map. And it is important in the private sector, the variation on the number of countries and what we see in the previous years. We have values that go from 1 to 15%, all of them in negative. For example, one indicator or one group of indicators that is very significant is linked to health and education. For example, poverty and learning, that is telling us that the rate of children that are under a certain age that cannot read or write any text, and it is compared to all of the other countries and per capita. Here we have, we have the darker blue, which is the value of the high income countries. And we can see that all of these countries are above on this rate. Children that are younger that cannot have over this income and they cannot read or write. We have descolarization or analphabetism, and we have the percentage of children that are theoretically at an age to go to school and they are not doing so. So here we can see the gap and northern countries in Europe. Continuing with education, Latin America and the Caribbean are a region that has remained with schools closed for the longest amount of time. We can see here on the left, and this makes it so that, we require access to internet to be able to study virtually, amongst other factors, as we can see, access to computers, tablets, etc. And we have centered our attention mostly on the access to internet. And what we can see here is the difference between the access to internet that the first income and the fifth incomes have. So we can see that, for example, in Uruguay, the value is smaller compared to the other countries. But in Peru, this is something that we've seen in the map. We have vulnerabilities, and it is a 62%. The countries that have an income,
mayores tienen 61.
or the homes that have higher income have 61.8% access to internet above those homes that do not.
Voy a pasar ahora a otra dimensión, que es la de género, que también nos parece una de las más importantes de incluir en este.
There's another dimension, which is gender. As over 28% of women above 15 years old that aren't studying, they don't have their own income. This makes it so that they depend on other members of the family or home, and also vulnerable people in regards to the pandemic. And we are adding the gaps of unemployment that there are between women and men. Here we can see on the right side, for example, in the first area on the left, and then we have on the right up to 2020. We can see that it has grown. Currently, the gap is 3.87% of unemployment that we have above the rate of men, and we have this compared to the countries of the OECD. But the gap between regions or different groups of countries has definitely grown. Other dimensions are poverty, inequality, and here we see that 8 countries in our region have extreme poverty, and this is reaching double digits. And inequality that we have seen in the different regions, that is same in each one of the countries in the world. And just to close up, I'd like to mention a few ideas. And these conditions, these pre-existing conditions, which we are finding during the pandemic, are generating inequality compared to other economies. And also the efforts for the recovery during the pandemic has to go further than what we see. And one of the goals is to help us to be orienting these policies for recovery from now on, not only for what we see during the pandemic, which is now, but also with a sight to be able to improve policies toward sustainable development and the commitment in fighting against climate change. That's been my presentation, and I appreciate your attention very much. Thank you very much, Daniela, for having shared the map. And this is a small sample of everything that you can find. A series of different data that we have found. This is a very good effort. And we also have to point out that it is important to carry out a political analysis for each one of the countries. And for this, just to inform that, at least from LATINDADD, we are here to be able to organize spaces, international seminars with international stakeholders to be able to review what these vulnerabilities are. I think that this is also important to have a national space to be able to carry out these events. So I'm here for anyone that wants to participate or wants to organize, indicate. We are here to support you from LATINDADD in the different countries. Now I'd like to give the floor to our colleague and friend, Andthe from Jubilee, United States. We have been working all of these months in this map. Andthe is going to be mentioning what the details of this process have been, and also, well, we'd like to know what the more global site is and how we can reflect upon these findings and the global policies for recovery. Go ahead. Thank you. And I apologize because I will be switching to English for my presentation.
I'm going to share the screen. Here, I want to show a couple of things before I go into the main part of my presentation. Just to complement, Daniela showed how some of these things look in a computer, in a PC. But we also took some screenshots of how it looks in a phone, because some of you will be viewing this in a phone. We really recommend viewing it in a PC because you'll get the most of the map doing it that way. But if you are viewing it in a phone, there are a few things that show slightly different. So for instance, you saw that on the screen, Daniela was showing the selection of indicator menu shows on the right side, but here in the phone, you'll have it on the top. And if you want to know what where the circles or bubbles are showing, you need to go here to this little icon that has an interrogation sign. And that there is where you can see the unit of what the bubbles are reflecting. This is another screenshot with a different indicator, but same concept. And then I wanted to also show, so if you click on one of the bubbles, also the box that you get is a bit different than the one you can see in a PC. It looks like this. So this is Peru, the private sector dimension, and the firm's access to credit indicator. So you can, and just like Daniela was explaining, you can, here, actually, you go here, you can select a different country. Here, you can select a different dimension. Here, you can select a different indicator, no? This is a screenshot, so you don't see this actually plain, but just to show you where you need to click if you want to change what you are seeing. So let me now move to the map. I think, so Daniela shared already about the motivation, and what I'm gonna try to share is the process, how we went from that motivation to the actual indicators, to the actual map that we have. So it is very clear now that the pandemic hit developing countries worse, that the effects will last longer than in advanced economies. You look at the IMF's data shared a couple of weeks ago, that the advanced economies will already return to their pre-pandemic growth trends in 2022, while developing countries will continue to see persistent losses for several years. And this has implications for the global actions to emerge from the pandemic, but they also have implications for pandemic preparedness, no? And of course, we hope that it won't repeat itself, the pandemic that we are seeing, but experts tell us that unfortunately more pandemics are coming, that we should brace ourselves. Whether you look at the G20 established high-level panel on financing pandemic preparedness, or the Global Preparedness Monitoring Board, the UN Biodiversity Panel, or others. So we know we cannot end the pandemic without ending it everywhere, right? So we set out to identify what are these factors that hinder pandemic response in developing countries and make the response more difficult. And one of the first challenges we found, of course, is that the pandemic of these proportions is a very recent phenomenon. A lot of the research, even about the impacts, it continues to emerge, but it's a very new phenomenon to look at, and some things that we would have liked to see reflected in data, we could not see the data yet. So, but we started with identifying factors that hinder pandemic response, trying to understand how they are relevant to that pandemic. It's not just a factor, but how is it that it affected pandemic response capacity in developing countries, and how they set an important difference with the situation in advanced economies. And we group these factors in what we, we group these factors into dimensions, no? And these are the dimensions Daniela was showing. And we found 12 dimensions. We classified the factors in 12 dimensions. So there is the external sector, fiscal sector, private sector, health system preparedness, education, employment and social protection, food and nutrition, climate, gender, poverty, and inequality. But then for each of them, if you take, for instance, employment and social protection, we have the indicators. We try to find the ones that would reflect, like I said, how they made the response capacity, how they made it more difficult for developing countries to respond to the pandemic, and how. And this is, so you see, remote working was one of the issues. The size of the informal sector, another of the aspects. Unemployment, changing employment, and you can do the same for each of the dimensions. But this was and in each of these cases, we try to identify indicators that could give us an objective view of the situation that were reasonably comparable across countries. And for this, we rely on the emerging analysis in the literature, like I said, but also consultations with experts, and some of these are on this panel. We are very grateful for their contribution. And also partners, and including LATINDAD members in the region who made us aware of many issues that probably just looking at data would not have been so clear. So for instance, when we were looking for indicators, obviously this is a health phenomenon, above all. So health system preparedness was key. It was just very obvious that we needed to look into what were the issues in the how the health systems in the countries were prepared to cope with the pandemic. And so we looked, ICU capacity, the number of physicians, number of nurses, private health spending, so how much each person has to spend. This is the out-of-pocket expenditure. So how much of the health expenditures a person has to make on its own, that it doesn't have some sort of insurance support. So that, but if you look, for instance, at other factors, it wasn't so obvious initially that they would be a factor, that they warranted a space on this map. So food and nutrition, for instance, one of the things that happened with the pandemic is that there were also hurdles for producers to move produce to markets. There were disruptions in supply chains. And this had and continues to have an impact on food security. And even though all the world experienced these disruptions, if you are a developing country with already high levels of food insecurity, which is what you are seeing here, you are seeing some countries, the levels of food insecurity. If you want to compare with high-income countries, you see in high-income countries the prevalence of food insecurity is 7.6%, right? And you are looking, in this case, we're looking at Peru, 47.8%, but you also have, you could look at Argentina, 35.8%, Guatemala, the top of the list, 49.7%. No? So if you are experiencing those disruptions, but you're already starting from a much higher level of initial food insecurity, it is going to be more difficult. It is going to create a bigger problem for the country. You can also look at food imports, because the disruptions in supply chains make food imports another relevant factor. Here you can, so this is the share of the food imports in total imports, no? And you can see how for some countries, it's, the higher the share is, the more than a country is likely to be affected by a disruption, no, in ability in supply chain. So now we faced, of course, a lot of data challenges. In some cases, the data just wasn't there for the variables we would have liked, or was not on a reasonably comparable basis, or it wasn't there for enough countries. We had to discard many indicators that otherwise could have been useful. For some, we found proxies. Daniela was sharing in terms of employment, for instance, no, the remote working figures. It's not really the figures on remote working, but we found that there is a very high correlation between high skill content and low skill content. So that's how the indicator here is the high skill workers. That's our proxy to see how much of the jobs, how many of the jobs in a country can be done remotely, which was an important factor also in the pandemic. And so Roxana probably talk more about that. For other indicators, we also commissioned research to gather data. With each of these vulnerabilities, we want you to take away essentially two sides. There's the pre-existing vulnerability that existed, how that limits the capacity of the developing countries. For instance, if you have high levels of poverty, that prevents access to sanitation, to housing and healthcare, and that hampers any efforts to limit the spread of the virus. But the other side of these vulnerabilities is they are themselves getting worse with the crisis. So, for instance, again, poverty, higher level existing, but the World Bank projects already that 150 million more people will be poor by the end of 2021. And in the region, we observe for all countries for which we have already data 2020 that the poverty rates rose. Another example is climate. Responding to the pandemic in a situation of a constrained climate response capacity, it can be really, we saw that in Honduras and other countries in Central America. I would invite you to check the case study on Honduras here. No? So it has a little box where you can actually see some of the connections between how being a country that had to respond to a climate-related disaster and in a situation of pandemic, and then having to deal with the pandemic in that situation, which makes access to good sanitation conditions more difficult, how those things interact. So there is a pre-existing vulnerability to climate, and we found that 75% of the countries covered are the climate response capacity below the world average. But also with the crisis constrained budgets, due to the crisis, we know climate investments to reverse the situation will become more difficult for countries to make. So this is a vulnerability that is going to worsen with the pandemic. So I end with mentioning three ways in which we think our atlas can be a contribution to a more effective, resilient, and inclusive and pandemic response and recovery. First, we hope that by shedding light on the broader challenges that developing countries at all income levels face, it will stimulate reflection on how the international community can better support them to overcome the pandemic across the full spectrum of financing for development. So this is concessional finance, debt, SGRs, especially the repurposing, the discussion now on repurposing, special drawing rights of wealthy countries to developing countries, lending policies. No? A second way in which we think it can contribute, it can guide those in charge of recovery policies on how to target them to ensure countries become more resilient to public health crises and their economic and development repercussions in the future. And finally, as new data continues to become available, and we're going to be updating this map, it will allow tracking progress and strengthening accountability in how we address these vulnerabilities. Because like I said, and unfortunately, we cannot really rule out that there will be more pandemics in the future, and we hope that we will be able to collectively work towards a better response everywhere. Thank you very much.
Gracias, Aldo, por esta participación. Y en efecto, tenemos indicadores.
Thank you, Aldo, for your participation. We also have indicators in 2020 that are showing us the impact of the pandemic during this year. And we also have other indicators, which are previous indicators, that are showing us what our countries look like before receiving the pandemic and how then they have been and are our capacities to be able to face this. Next, we have the pleasure of giving the floor to Daniel from CEPAL. We have seen concerns in the region and how basically all of our countries are found in the fiscal deficit, some for several years now. And we see that the pandemic comes and this gap is larger, and additionally to debt and financing, because we have access, because we are middle income countries. What is the evaluation of CEPAL against these vulnerabilities? Go ahead. Well, first of all, thank you very much for the invitation. This is a very interesting event and to be able to share with so many friends. Well, I would like to start by highlighting the index of vulnerability and the importance of it and how it's aligned with the work that we have been carrying out with CEPAL for the last few years. And what we mean is that we have per capita, it's just not measuring the challenges, it's not measuring the state of development, but also not the challenges that the country are facing able to have more development.
Per cápita dejaba de alguna manera ponía un
Now,
manto.
based on this GDP, we have sort of a blanket of lack of transparency and quality, and for the structural problems that we have in the countries to be able to go towards better development. And that's why this index that has sort of a comprehensive focus on trying to measure the vulnerability. We have these indicators that we believe, for example, tools such as this, which are very good for being able to overcome. So I would like to thank you and congratulate you. And if we have a holistic and integrated support to be able to evaluate the dynamics for the different bottlenecks that we have seen. And well, in regards to the points that you were making, I'm not going to be presenting a PowerPoint because of time restrictions, but we have this to be able to share further along. And well, one of the traits of the effect that we have on the pandemic and what we've had so far in public policies is the economic and social aspects. And the first things that they're manifesting, and these have incremented, they're magnified by the structural problems that the region already had before the pandemic. And as you have already mentioned, we had the tax restrictions. This had already been failing, but also the basis for social inclusion, informality, the poverty problems, etc. And these have been factors that have magnified the effect of the crisis, which was provoked by COVID-19 in the region. And Latin America, one of the regions in the world that has most of the development that has been affected, and middle income as well, and the region that has been affected the most because of COVID. Well, we have the drop of compared to last year of over 6%, which is higher in the world compared to other countries in development, having more unemployment, and the loss of jobs is the highest compared to other regions in development in the developed world. So the structural gap and the structural problems that the region had, trying to sort of capture and cover these vulnerabilities, and they have impacted during the pandemic, and they are going to continue impacting the dynamic for recovery that we have in the region. And well, in this sense, it's very essential to be able to start to quantify and measure how the structural issues are going to be affecting the dynamic for recovery. And in particular, we're looking at transformative recovery and the recovery that we have to include not only for growth, but also in the productive transformation that is going to allow us to have a better sustainable production and to be able to grow, to be able to promote social inclusion. And from this perspective, we have the tax perspectives that are higher. Latin America, we had more of an impact to be able to face this crisis. So we know that the region is making the fiscal efforts, and in average, it was 4.6% of the people, which we haven't seen in other different crises. And of course, this is in the situation in which Latin America has been working, because it's not that strong, because the primary deficit since 2019, we had 0.3 or 0.9%, and the countries have been readjusting. We have been covering this before, and they're making a fiscal effort, a tax effort that is very strong. And it is definitely in the majority of countries and part of the countries that have less of a fiscal income. We have a larger deficit and a large debt. In average, in the public, we have over 56%, and this amount is varying depending on the country. Almost 30% in Chile. We have Paraguay, 28%, but there is a large amount of diversity in the situation, but the public debt has definitely gone up, and it's going to continue going up. And because of this, as you have well mentioned in the introduction, the countries are not having access to credit, and it is a little outside of the multidimensional aspect or middle income, out of what the process is for renegotiation of the debt and the capacity to be able to have access to global income, and well, etc. And what we've done is, in this effort, is to have financing to be able to cover it. We have more of a fiscal debt. The debt is going up, and we are also closing a very high importance in the payment of interest on this. And well, we also have a certain weight on the availability of resources. So the countries have a gap and a vulnerability that is very strong. The need for financing, which is going up, and also the capacity we have to be able to cover these, both internally and also externally, because of the condition and that they have a middle income conditions and all of these mechanisms for assets. And we believe that there is a very large vulnerability that the region has to face. So well, we have to, well, I've gone over my time, and I'm just going to leave these two subjects on the table. One of them is a very large challenge, and the tax vulnerability, and how to have a structure for expense that is in crescendo, it's growing. And we have actions, we have a dynamic which is suspended. And this happens when we have one of the larger vulnerabilities in the region, and also the tax income. And CEPAL, we have looked at this need to raise the taxes. When, for example, we have taxes compared to other countries, is very significant. We have a percentage that is lower, much lower than other areas in Latin America. And the large challenge and the larger vulnerability is how to have higher income to be able to sustain more of an expense, because the mechanisms are no longer being able to support the expense, and we have to have the expenses and upwards. And there's a very large challenge on how we are working. And of course, as well, to start considering a tax on wealth, patrimony, and a series of different elements. That is definitely something that we believe is very important. Another element that we believe is a very large challenge, this is linked to the capability of moving different areas under conditions that are higher. This is, for example, I would like to put on the table this entire debate on the distribution of special interests, and how this can bring up and make the capacity of the different countries in the region go up. And well, this is definitely a challenge for us to be able to diminish the tax vulnerability until these processes change and we begin the operation. And well, how we can channel global income to be able to have these fiscal spaces and have this be covered. I don't want to close without mentioning another large challenge, which is to reduce evasion, tax evasion. And well, we have over 6.8% of the PEEP, which is millions of dollars, which is a very large amount of money in evasion. And well, we have this as part of the tax vulnerabilities and our own vulnerabilities. Thank you. Thank you very much, Daniel, for all of the analysis and mainly all of the challenges that you pointed out. And well, the challenges that we have seen are a series of campaigns that we have had from organizations of civil society, movements, social movements in the region. And well, we will very happily bring all of these recommendations together, and we're going to reinforce the role that we have as social society or civil society. Thank you very much. Next, I'm going to be welcoming to be able to take the floor here on this panel. We have Camilo Cid from CEPAL. Camilo has also collaborated in this process with a guide about what the indicators, the most relevant indicators would be in regards to health. Camilo, how vulnerable is our region? We have all felt this ever since the pandemic came in regards to health and also the other impacts which are a consequence of what we have had, and what is our response capacity, and how are we doing in regards to what we can see. We are no longer going to 100 years with more frequency. We're going to be seeing more pandemics of this type. How is Latin America prepared? Thank you, Camilo. Go ahead. Okay, well, thank you very much, Patricia, and a good afternoon, everyone. And I am going to be presenting a few slides. Let's see if I can share my screen.
Ustedes me confirman, por favor, si se ve.
La podemos ver bien, Camilo.
Bueno, lo primero que habría que decir es que las vulnerabilidades.
The first thing that we're going to say is the vulnerabilities begin directly with the impact of the pandemic. Well, there is effect in the pandemic in the region related to its population, and well, the region has definitely had over 20 or 19% of mortality. It's gone down to, well, it's been 8.4% of the population. And it's a very large percentage of those that have been infected. And the population is much, much smaller. So this is information that has been very relevant, because at the same time, we have the vulnerabilities that have been pointed out, and it makes it so that well, we can see that this has been an impact that is much higher. And well, the impact that we have had, again, the impact that we've had on the social level has been very relevant. As we have mentioned, Daniel, we've had work and how we've been affected, and the informal and formal workers and young people. We have a larger amount of poverty, inequality, and well, we've also had the deployment of social protection, which is very important, that has implemented, or that has been part of the poverty going up. There are numbers that I'm not going to stop on, but it might have been 230 million before in 2030, and not the amount that we see now that has grown in the pre-emergency and social protection. Social protection is also evident that we have been able to promote control and mediation of public health in the region. There are very many studies about vulnerabilities. Here we can see something that we already know, and that there is a detail in principle in several countries, and how isolation definitely has the larger amount of vulnerabilities. There have been more access of mortality because of COVID-19 in these countries. We've had a deployment, or we have seen a shift of different illnesses in the region. This study that is carried out by the OMS in general is showing that in the region, 35% of the countries have registered some sort of interruption in being able to provide healthcare for other issues not regarding COVID-19. And this is going mostly 25% of this is primary care, which is close to the people, and 31% of these interruptions have been moderate or been very severe. And well, in the region, we have found a very high amount of expense in the expenses that we have for health. Financial measures or financial resources that is very low. We have chronic financial issues in the region that has created an amount that has gone down in the countries, and each one of the homes have had less income, and this has affected them very much. And we can see here the expense out of pocket is very high. It goes over 20% of the total amount in health, and an average 1/3 of the income. And the public expense is less than 6% of the people that the countries have been going over in the MS, and only 2 countries are going over that number, which are Cuba and Uruguay. And well, on average, the public expense in health over the PIB is 3.8%, and the average of the countries in the OECD is over 7% of the public expense in health, or more or less 20% in the out-of-pocket, which is the gap that we can see. And well, this is showing here, you can see on the data that is being shown, is that there are problems for financing key resources for infrastructure and human resources. For example, we've seen human resources for example, doctors, or being able to have a room per inhabitant. So we can see here on the lower left of the screen where you see the doctors available and the beds available are very low. And the expense in the pocket is something that is relevant, because not only does it generate problems for access, but also in long term it's health issues, because they have problems for the access, and people are going or not going to the doctor in the cases in which they cannot even have this expense. So it creates more poverty, because when this expense is leaving families underneath the poverty line, we have the follow-up information from the ODS. This is showing that this chart here, some of the countries in Latin America, amongst which we can show that there's a very significant impact, 2%, 4% of the population in some countries, and most of them, over 1%, is being impoverished because of the expenses out of pocket for health. And out of pocket expenses is not equal. When we talk about financial protection coverage, we can see that even if the catastrophic expense is affecting the families that have more resources, or they have relatively more expenses or more resources, it is the 5th most affected, but in the impoverishing is predominant, and those that are the most affected or fall into poverty is because of the product of the healthcare, out-of-pocket healthcare expenses. Other issues that have not been solved, and this is part of the pandemic, is a segmentation and fragmentation of the systems. This is something that we've seen in time, but we can see the different segmentation of different healthcare systems and different levels of access, results for quality, at the end of the day generates more inequality. And this is also something that has been affecting mitigation of this poverty. During the pandemic, fragmentation operates on a service organization level, and it creates lower development. And it has also been very important during the pandemic. Countries have taken measures, but it has not been enough. Here we can see the evolution of the pandemic in general, and the evolution of healthcare in the region, and we can see how they've fallen apart. These are problems that the countries have had to be able to manage their measures to be able to respond to the pandemic. And another thing is the impact that they've had on vaccination. Vaccination has had a very significant impact. And well, at this moment, the most relevant factor for health and the recovery of the economy, or sustainable development, is affected. And this is something that is within the process of vaccination. We have to complete this process for vaccinating all of our citizens. But even during the vaccination, there is a problem. Vaccination in the Latin American context is moving forward very slowly. We have to vaccinate, and we can't even reach 80% of the population. and we are late in coming into this process. And just to finish up, to not end my time, I would just say that just to compliment on what Daniel was saying, the state has had a very important role, significant role, not just for mitigating the pandemic because of health and other sectors, social sectors, but also in policies, which has been tax policies that have been promoted. We require new fiscal pacts, new taxation pacts that are putting health in the center and giving more financial sustainability, allowing investments in public health to go up. And so we have to face what we have in the pandemic, because this is something that is influencing demand that, which is for those that have been displaced. And on the base of sustainability, or basis of sustainability, it is possible to restructure the health systems to be able to recover from the access barriers and give a universal health. And I'll be left here without health. There will be no sustainable recovery for everyone. Thank you very much. Thank you very much for the explanation. What have been the impacts, what the challenges have been, and if the things that we continue having in our region. We can see what our indicators are on the map of vulnerabilities. I would like to take advantage just to remind everyone that you can ask your questions in the question and answers icon on the top. Taking advantage, we have to respond to all of these questions related to these subjects. So next, I'm going to be inviting Roxana Mauricio from the OIT. Well, we can see here in the region, it's a high level of informality, and with measures for isolation. In many cases, we have a very tremendous impact on employment and also on women. What are the vulnerabilities and the challenges that we're facing, that the OIT is facing during this pandemic and the crisis?
Bueno, buenos días, buenas tardes a todos. Muchas gracias, Patricia, y a los organizadores por...
Well, good morning, good afternoon, everyone. Thank you for having invited us to participate of this very important event. And well, this is something that we have mentioned before. Daniel, we have the importance, this initiative, especially during this moment of crisis, to be able to monitor. And well, as we can see before, the idea is not only to have the previous to the crisis, but also to be permanently monitoring the behavior of different indicators in regards to the OIT, in particular the labor and social indicators in the context of the pandemic, but also to discuss the policies and also the measures for the recovery centered on people, in particular those that are in employment. And as we can say before, Patricia, you said what has been mentioned by Daniel and Camilo, clearly this pandemic has had an impact, a very significant impact on an economic level, and in particular in regards to the work market in the region, that has generated an impact and indicators that of employment indicators and also social protection, and simply for the region. And for example, when we look at what has happened in the evolution of the average population in the middle of last year and the second trimester of last year, after having falling average 9% percentual in the region compared to the first trimester, and we have the rate of occupation in the region has gone to new levels in the region. And in parallel, and here we can see something that is new in regards to the previous aspects, is something that we can take into account. This is part of the perspective, the gender perspective. In parallel to this, that's just very strong on the level of occupation. This is a loss that is very significant in positions for work. And compared to the first trimester of last year, 43 million people have lost their occupations between the first and second trimester of the 2020. And this fall has been accompanied by a massive loss of work. And here we can see that this is going out of the workforce, of the labor force, and this has been observed mostly in women. This is something that we can see. There's a gap that has been intensified very strongly, which is a greater gap of female participation in employment. And if we look at what has happened, what is the rate of participation on the second part, in the second trimester of last year, women, we have to go to about 15 years back so we can see the same rates of participation in women. And so this is something historic that women have seen us stepping back in. And so this panorama of this very strong fall of occupation and us leaving the work market, this is also making the rate of unemployment stronger that have been going up, but it's gone up less than what it would have gone up if we had these work markets looking for jobs and the women are not looking for work. And so from the OIT, we have proposed to look at, or in particular, we have indicators of hours worked, because it is the amount of hours that have been worked that are summarizing, or this is an indicator, which is a more global indicator, more comprehensive and integrated during the pandemic in the work markets in the region. Why? Because when we consider the average amount of hours that have been worked and we look at this very strong amount and the average of hours worked, we see in Latin America and the Caribbean, this was the most affected in reduction the areas of work in a global level. So in average, the region has lost a double amount of these.
Obviamente, con la caída fuerte en las ocupaciones, que implica obviamente reducciones fuertes también en las horas trabajadas, pero también reducciones fuertes en las horas trabajadas de aquellas personas que continuaron trabajando. Entonces, de alguna manera, las horas promedio nos dan una medida más integral de los impactos que ha tenido la crisis.
Comprehensive idea of the different markets in the world and in the region. And another fundamental aspect that we have to consider, and Patricia, you've looked at how in this context they have been behaving in the formal and informal work markets. And here we can see another thing that is a novelty. It's different to the previous analysis, because in previous crises we have seen that against the fall of formal employment, informal employment had a sort of a cycle. It was playing a role, and it was within the context of the crisis. And in this particular issue regarding the crisis, the pandemic, the restriction measures, and in regards to mobility, the informal work positions in these regions have been losing more work than the formal market. So this has exacerbated more in the work regions in the areas. So if we look at the first trimester of last year, the rate of informality, working informality, and average in the countries in the region has been reduced in this critical context of the work markets. And what has happened in the recovery, the partial recovery of employment, as we have been able to see from the middle of last year until the last data that we have here, is first the amount of unemployment that is lost in the first semester in the year 2020 has not been recovered, and we still have about 30% of those positions, work positions that have been lost that we have to recover. And we have to have over 40% that has to be recovered in the case of women and 20% in the case of men, which again, and this has been established in the employment that has incremented in comparison to what we have had in average in the country. And we can see that this partial recovery of employment from the middle of last year has been led very strongly by informal work positions. And in part of what is being reflected upon this, we have the return of the workforce to those workers that are informal workers that have been losing their jobs when they have left the workforce in the first semester of last year. So this rate of informality that we can see has been contracted very strongly in the middle of last year is starting its recovery, systematically speaking. And more so ever, there is a latent risk that we are observing in some of the countries in which this recovery of these informal positions and what we have in this rate of informality not only is this associated with transit or the exit or the loss of work positions, but also we can observe transition of different work positions towards formal positions. So we are looking at the different processes for formalization of the formal positions that we have already had last year, and then we find this generation, this additional concern. Another very important aspect, and again, something else that we can look at, and we're going to be maintaining in time, another important aspect that was mentioned before, it is a very important indicator which is included in this map of vulnerabilities, is linked with teleworking or remote working. We have been monitoring and analyzing, characterizing this phenomena of this remote working in the context of the pandemic. Of course, this is not a new phenomenon, but within the context of the pandemic, it has been something that is going to be continuing with some of the occupations in this very critical context. And then another very important aspect is that in some way, teleworking or virtual working has been facing, compared to who the workers are, what the characteristics have been, the workers are that have been losing their jobs. And if we look at the counterpart, which workers are those that are more likely to carry out their work from home have been the formal workers, those that have higher educational levels, higher goals, and those that have more teleworking or virtual working kinds of jobs. These are mostly managing and the use of communications and information. As Aldo had mentioned before, the indicator that has been included is an average because we are including this with occupations that are
y que requieren intensivamente el uso de información y de tecnologías de comunicación. Desde la OIT, en realidad estamos haciendo un esfuerzo para identificar, caracterizar y continuar monitoreando lo que llamamos nosotros el teletrabajo efectivo.
What we call teleworking effective, virtual working, trying to identify, directly identify who in response are those workers that have been continuing their teleworking tasks. And of what we can see is that even though after we've had this very strong amount of teleworking going up, it's been going down compared to what we have seen in these measures for restriction to mobility. And we have also had incidents in teleworking, which is going up much higher than what we have previously had. And probably we're going towards a different hybrid framework. And in this hybrid framework, not only do we have the statistics compared to teleworking, but also the legislation which is associated to.
Que continuamos monitoreando porque especialmente la región tiene un conjunto importante de países que avanzaron en las leyes nacionales de teletrabajo y es interesante analizar el contenido de estas leyes y sobre todo para aquellas que habían sido pensadas previas.
For those that have been thought out mostly during the pandemic and what the measure is to be able to cover these very specific context during the pandemic. So if we consider all of these effects in a grouped together manner, not only has it been women, we have those contraction of employment, the contraction of income has been more for those that are informal workers and also young people and workers that have lesser qualifications. Clearly, the panorama is showing us how these higher contractions in the incomes, mostly the employment that is informal employment, is the lower part of the distribution, of income. And understanding that this income is the most important part, we can indicate the most important part of the income, total amount of income for the families, is how we can understand how the pandemic has had very unequal impacts and making the gaps larger in the work markets. And this has made the levels of inequality and levels of poverty go up. Levels of inequality, of poverty and informality that were already very elevated before we had the pandemic. And just to give you information, in average for the region, 1 every 2 workers are informal workers in 2019, showing very clearly that there is a situation in which we find vulnerability. One of the indicators that are showing us the largest amount of vulnerability that we have in the work markets in the region. And in this context, the OIT has called to the world to create actions to be able to point towards the recovery based mostly on employment and of course in decent employment, formal employment. And this requires a joint amount of very, very important, very integrating policies, from macro policies to policies that are work policies that are specific, that are concentrated on certain groups that are confronting different vulnerabilities and higher difficulties to be able to insert themselves in the market, mostly in the formal employment market. And this requires stability, growth, the macroeconomic stability and growth, productive policies to improve the productivity of the bases and every one of these establishments that are smaller, that are concentrating mostly on the informality. But clearly there is another role which is very significant for the active politics for market, those that are associated to training people, and fundamentally speaking, all of these new technologies associated to transition policies and digital transition, and particularly focusing on the very important role of the work institutions.
Y en este sentido, cómo ampliar un gran desafío que tiene la región es cómo dar garantías de ingresos a través de componentes contributivos, como podría ser el seguro por desempleo, pero también componentes no contributivos, sobre todo elementos que
contribution or non-tax contributions, which is something that can give us more security for income in the more vulnerable populations and the other workers in the informal market. Thank you very much. Thank you very much, Roxana, for this description of something that we are living in our countries, that we do know about this reality, and on top of that, it's just showing us what we have to do in regards to unemployment and to be able to cover the socially dependent in the country. And here we're now going to be inviting our last panelist, and well, she is Deborah Lay from CEPAL. Deborah, thank you very much. Deborah is going to be talking to us about how or which are the climate vulnerabilities in the region and how we have seen the exacerbation of this, because this has been affected by the current crisis on the side of LATINDAD and several different allies. We have proposed different policies such as the suspension of the debt payment for the countries in Central America that have been affected by hurricanes and other climate factors. And for example, what is related to economic issues and also the climate situation in the country and in the region. Deborah, please go ahead.
Débora, no tenemos audio.
Una disculpa. ¿Me pueden confirmar si ven la pantalla, por favor?
I would like to apologize. Can you see my screen, please?
Gracias. Bueno, pues buenos días, buenas tardes, dependiendo de
Well, good morning, good afternoon, depending on where you are. It is an honor to be able to be here in this panel with all of you. In this moment, so I'm going to be speaking to you as a leader of the Intergovernmental Panel for Climate Change, talking about this 6th cycle. And well, speaking about the special report of global warming 1.5 degrees, and where we've also had the participation of authors and scientists in the region, either leaders such as, or also those that are contributing, or how we are reviewing this. One of the main messages is that since pre-industrial times, the human activities have caused global warming, and this is committing not to 1.5 degrees centigrade. Now we have in our power, we have the tools to be able to reach that goal of 1.5% or 1.5 degrees, and making a comparison between global warming between 1.5 and 2 degrees, we can see at 1.5, we're going to have less extreme climate. This is including heat and extreme rainfall and drought. That for the year 2100, in the level in the measurement of the ocean is going to be 10 centimeters less. And it's going to continue warming every century, and 10 million less people exposed to risks to the increment of the higher sea levels. And well, there's going to be less of an impact on biodiversity and species. There's going to be less risks for fishery and people that depend on the fishing industry, less reductions and the farming in corn, rice, and barley, which is also a population, global population that is exposed to more of an increment of water, lack of water. It's 50% less if we have 1.5 compared to 2%, and hundreds of millions of people less exposed to climate change and exposed to poverty by 2050. And so here we can see the message, and what we want to reach is that even though in the negotiations in the Paris Accords and being able to reach 2.5 or 1.5, we do have impacts which are very significant impacts that we can avoid. And when we have global warmth that is 1.5% compared to 2%. And in this figure here, we can see this is the burning embers. Here we can see the impact and risks that are associated for different natural systems, both human and administered by men. And so here we can see the horizontal gray line is where we are currently at. which is a little over 1 degree centigrade over the pre-industrial times. And we can also see the lines of where we can find 1.5 and 2 degrees centigrade. And in this type of chart, the white sector is where we don't have an impact. These are mostly imperceivable. The yellow is where we have an impact, which we already feel, but it can be where we are implementing measures of adaptation. Red is now more severe impact, where we're going to need perhaps more transformational adaptation. And the purple is risk that is irreversible risk, where we are going to be reaching levels where the systems are no longer recoverable and where the measures for adaptation are no longer going to be feasible. And so here we can see that the systems that have the higher risk are coral reefs, warm water corals, small scale low altitude fisheries, Arctic region, coastal flooding, and well, these are applied mostly in the entire region of the world. And we can see that the ecosystems, the terrestrial ecosystems, we can see that we do have floods, and we can see a drastic change between 1.5 and 2 degrees. And what we see here, compared to what we can see in the coral reefs and the Arctic regions, the changes have already been felt at 1 degree centigrade, and the difference between 1.5 and 2 degrees are very small. But in other systems, such as some of the fishing, flooding, coastal flooding, the difference between 1.5 and 2 degrees is significant. And so this is something that also shows us why it is that we have to make more effort in staying within the range of 1.5%. And in regards to trajectories of the emissions of greenhouse gas, we have warmth of 1.5%. Emissions of CO2 have to fall between 45% by 2030 compared to levels in 2010. And we definitely need to limit global warmth from 1.5% in the emissions of CO2 to be able to reach zero, the net zero, close to 2050. And we have to reach this before 2075. And these limits are not only linked to emissions, but are also linked to the impact in health, in food safety or security, in the water resources, etc. And this limitation of warmth from 1.5 require great reductions in emissions in all of the sectors, changes in technologies, changes in behavior, and more investment in the lower carbon options. All of us have a role to play. And here we can see, well, we have 4 different trajectories that are illustrated here that are showing us different trajectories that have been modeled to be able to show how we can reach 1.5% or 1.5 centigrade. We can see on the left, we have P1, which is a more sustainable, and P4, which is on the far right, less sustainable, something which is more intensified in the carbon neutral. And the 2 main differences that I want you to look at here is the degree in which we're finding reduction between P1 and P4. P1 is quicker, and P4 takes longer to have the reduction, but it is a more pronounced scope. So the longer we take to reduce, the quicker or more pronounced we're going to be looking at this reduction. We have to carry out the reductions. And another significant change is the entire yellow area, what we see in P3 and P4, which are where we're going to be implementing technologies for removal of carbon dioxide. And it could be through mechanisms which are natural mechanisms or reforestation, but also technological resources that have a different series of impacts linked to water, food safety, equality, and justice. And so for this case, we made feasibility of options between different systems that are energy, land, and ecosystems, industry, and cities. And these were made for different options of mitigation and adaptation. So here we can see an example, which is the darker color, which means that it is mostly more feasible, and the clearer colors are less feasible, which means that there are more barriers. And the advantage of carrying out a feasibility analysis in these economic, technological, and institutional, social, cultural, environmental, and geophysical aspects is that we're not talking about feasibility as something that is white or black. It's where the different dimensions fall in and how we have to pay more attention to the areas that need to be paid more attention to, more effort, more attention. And so this is something that we can look at in the special report at 1.5 degrees. And now the sixth cycle, that is now what we have underway. We have mitigation and reduction, and we're carrying out a feasibility analysis that are broader. We are making all of the feasibility of synergies and different movements and between adaptation and mitigation. And the final part of this report was how we are linking this to different sustainable development goals. Even though the study of 1.5 did carry out this analysis only for mitigation, the AR6 is doing this both for mitigation and also for adaptation. The report of the second group is being launched in February. Now we are finally in the final reviews, the government reviews for policymakers, and we expect that in March we can make more of a presentation. And just to finish up here, I know that I went over time a few minutes, and it is that to limit global warming to 1.5 degrees, we need systemic changes which have to be transformative, integrated, and sustainable development. And these changes are going to require scaling and acceleration of the implementation of mitigation, which is a larger scope, and all levels and sectors, taking into account all the barriers and the trajectories that might be going over 1.5 degrees that are those that we have above the levels of commitment that we have. Now, we also need a mix of different mitigation, adaptation options, not just to have one option to bring us to our goal of 1.5 degrees. And so we definitely need to implement all of the actions that have been made reference to. And this is everyone's job, not just one sector or the private sector, for example. It's also actions that can be taken that have to be supported by our national governments. And there is also an urgency, is realigning our climate in regards to savings and expenses and infrastructure and resilient infrastructure. Thank you very much.
Por la interesante presentación.
Thank you, Deborah, for your very interesting presentation and telling us what all of our climate vulnerabilities are in our countries in Latin America. And together we can look at, as we said in the beginning, we can see this in a more holistic manner, what all of the sums of vulnerabilities are in our region and in each one of our countries. And so how we are going to be generating public policies as well that are going to be tending to these vulnerabilities. Oh, we are now out of time. I would ask you, and with your permission, we're going to give ourselves about 10 more minutes to be able to answer to some questions, and for our panelists also to be able to give us a final parting message. And so without further ado, well, we have a question that we're going to be asking Daniela about a clarification on what the years are of these indicators, 2019, 2020, or are these variable between the indicators? We have spoken of this, but I believe that it is important, Daniela, you can tell us where to find these so that the users can know where to find each year what the corresponding indicators are part of and where you can compare the different indicators or not, apart from a parting message from you, Daniela. And well, we also have another question, which is for Aldo, and he's asking us basically if, well, is it necessary to have income or inputs from the different countries to look at the different methodological impacts, and in this sense, to
make a modification of the resulting indicators? This question is what we have from Alexander from Mexico. Well, we have other questions. I'm going to be asking all of the questions that we have already registered so far, and then I'm going to give the floor to each one of the panelists in the same order. Well, I have another question for Daniel, and it is about the use of cryptocurrency. Can this generate vulnerabilities, some more vulnerabilities in regards to tax issues? This is for Daniel. And we also have a question for Roxana. Question, which is if there are indicators that are showing the differentiated impact and workers in the formal and informal sectors, and if we're looking at which are the work hours that are real work hours for women versus those that are paid work. So if there is work women are doing that is not paid. And I guess this is another question for Camilo. Now, going into these questions and answers that I have seen in our chats, and well, this is a question from Peru about a group that is more vulnerable in the case of HIV and AIDS, I guess. And a question, I guess I would change this question in the sense of what we can see from Camilo, how to prioritize these different needs in the health sector and in this moment for the pandemic or in the crisis context. And last but not least, we have a question that we have registered for a few moments ago. We're not going to take more. This is for Deborah. And she is asking us if there is data that's comparing the damage to coral reefs and other coastal elements or insular island elements. And this is just to summarize the question. And so on the other hand, well, we have other questions which are more general, but also at the same time, they're specific. And these questions are about recommendations, taking a starting point from this map. And I would say that this map is a tool for the users that are civil society, academia, political sector, parliament, and even government workers, so that they can have more arguments in the proposal of determined policies, public policies, and the response of public policies from the different sectors, from the different interests and needs that we have in our countries. So this is a map that is no proposal per se, it's recommendations, it's giving us arguments so that each one of us can use this in our countries on a national level and also on a regional level and global level. And so with this explanation, thank you very much. And we would leave this, we have 1 minute. Please, Daniela, go ahead. Thank you, Patricia. The question, I'm going to I tried to answer it in the chat, but yes, most of the indicators are until 2019 or 2020. It depends on the data that we have from these sources, mainly the ones that have been used. And when we want to look at what year the information is about, we go to the chart information and we can see what year it corresponds to in this group of countries. Perhaps it is just one group of countries, and the indicators that we are going to be needing to look at, most of them are to 2020, 2019, but in some cases, we can mention here family agriculture, or we could also mention social, and we have data which is a bit more lagging. Here we have the information available in each one of the countries. So I do believe that, just to close my comments, just to thank everyone, I do believe that a lot of the subjects that have been spoken about in each one of the sectors, and we have the specialists, we are including this, we have included this within our map. And I believe that as a parting message, we mentioned two things. First off, that we have to talk about development more and less about growth. This implies putting people in the center of the debate, life in the center of the debate. And as a second message, I would like, or as we had been saying, we want this message to be for us to propose more integrated ways of working both regionally and nationally. And so with that, I would just like to close my comments and just to thank for the opportunity once more. Thank you. Aldo, please go ahead. Yes. Well, in regards to the evolution of the indicators, we're definitely looking at how when we have new numbers for each year, this is something that, well, the idea is to look at this. We have the questions, we have sort of an x-ray of what's happening at this moment, but we're going to want to know. And this is one of the things that we have in the country. It's going to give us a basis that is going to help us to look at how these indicators are also moving towards the future. And again, the indicators are a very important point here that when compared to other countries. We have a lot of different jobs where we are trying to identify indicators that are going to be allowing us to see this through different countries in general. In some cases, or in most cases, there are no indicators for all of the countries. There's no information for all of the countries. So the sample, this is what we can do to make it comparable and trying to find national ways to be able to gather the information. And I do believe that it would be damaging for the integrity of the information on the map if we did otherwise, because the effort was to find indicators that were comparable to the database. And I believe that we can criticize very heavily because we have a certain database and the different indicators, and this is legitimate. And in this sense, and we are looking at what the indicators are for each one of these. And in principle, we also said that whatever it is that we choose, it has to be transparent. And well, if we go to the database, we can find the source for each of the indicators. And well, if we say we're taking this from the World Organization for Tourism, Municipal, or World Bank, and now what we can see is we have to maintain, we can look at what the sources are and also to replicate the database and looking at what the methodology is that is being used for each one of these data. And well, how we have chosen all of this information, we couldn't say. We were looking at one of the questions, which was about non-paid work for women, for example. And this is something that we did think about in several different ways on how we could quantify this. And I believe that the reason for these indicators is that we didn't have the information. This information was going to begin perhaps in a database, or at some parts we are starting to gather, and these are with traits that we can take. And so I don't think that we are close to, if there are other indicators in the future, be able to be more robust, or for having this, let's say, this comparison, so that it can be incorporated in the future. Perhaps if we don't have them right now, we can incorporate them in the future, and they can be part of the capacity, or responding capacity for each one of the countries to be able to respond to these issues. Thank you very much. Thank you very much, Aldo. Daniel, please go ahead. Well, thank you very much. In regards to the question on the use of Bitcoin, I would say that we don't have enough experience. And what is interesting is Bitcoin, these are sort of a value deposit. It's not sort of an exchange or a payment. And I believe that this is very highly volatile, and it has very high expenses because of this. But in regards to fiscal policies, you can see that the majority are value deposits and they're not registered. It's not that they would be part of this analysis that are going to be generating, for example, any earnings there. And if there was a way where we were talking about if at some point it was going to be sort of a way that if people were going to be paid, it's going to be a challenge. But so far, there are ways of just keeping their wealth, just storing their wealth. These are not subject to taxation issues so far, as mostly savings. So that's what I'd like to say about that. Thank you. Thank you very much. Camilo, please go ahead. Yes, in regards to the question on how to prioritize that which we can, or the different needs that are displaced, as we had pointed out in the presentation. Well, the indication has already been given by the countries. The countries have already been incorporating in the measure of their possibilities and structuring the system and restructuring
the use of resources to be able to respond. The displacement has happened mainly in primary attention, but also in the more specialized areas. And well, in principle, I believe that the answer is on that side, in general, more specialized in hospitals, the emergency room beds. And well, here we have seen the importance of the second stage in generation. We have primary attention coming up, and the countries have been realizing that that's where the answer is, in strengthening primary care and allowing us to deploy. And well, this is for the resources, both people resources, financial resources, and to give first level care, and where we should have more or less 30% of the budget resources. Very few countries gather this amount, and in Latin America we have 19%. And so we have efforts that have been carried out there. And well, one talks about primary care, specifically those health issues. In the case of chronic illnesses, non-transmittable chronic illnesses, we have a lot of importance in the programs for medication and acquiring medication. So there is also a lesson learned there, starting from the vaccination and well, the different trends that we've had, the different capacities of being able to supply care. So there is an advancement towards the decentralization on a country level and on a regional level, and how to allow access to these medications, which are essential medications, without delay and without cutting off treatment or without going over the levels of access that previously existed. So there are more things that are more budgetary or management countries have been managing that are linked to shifts or more specific issues, but we have to mention those that have been already been very, very clear. They have been clear, they are clear. And so in general, just to thank and congratulate you. No, we haven't done that because this is a very great advancement whenever we can gather information and have an integrated, combined analysis. For us, the technicians or those that are more in technical, those that are civil society in all of the countries and everything that implicates all of the needs to be able to improve conditions, we take this into large account, and thank you very much. Thank you very much, Camilo. Roxana, please go ahead. Well, thank you very much, Patricia. Well, very, very briefly, and related to the two questions. The first one, which was linked to differentiation between the impact and the evolution of work informality between men and women. There is definitely the last report of the regional IT. The title was Employment and Informality in Latin America and the Caribbean, the recovery, which is insufficient and unequal. And why do I mention this? It's because it's focusing on the dynamic of informality and the role that they've had both in the first phase of conduction of employment and impartial and impartial, and also the link between equality and inequality. And there is where we see that the gender differences are fundamental, and we're looking at how in this very strong drop in working positions and formal working positions have fallen more in the case of women, because these sectors that have employment for women, these are more linked to sectors that have a larger amount of work informality, and these are sectors that have been affected mostly in this crisis. So in this report, we are analyzing these dimensions and these links between informality, gender, and inequality. And in regards to the second question, which is also more linked to this, it is about the impact and time worked, the amount of hours worked in the case of women. And also we have a very specific analysis of the average hours worked and this drop that we see that has made a principle in employment and how much we're bringing towards employment, the total amount of hours and the reduction of the hours for young people to continue working, and these equations, these contributions from the different factors to the complete fall of the hours worked in the region. And this is different in the case of men and women. And we also have other aspects which are very important, which were to analyzed in detail in the previous report, which is a report that was mostly about teleworking. And a point of this dimension that was very important is the work between responsibility, care, and family responsibilities. And of course, this is not a new aspect, but in the context of teleworking, this is something that becomes more visible, and they have connotations that are their own connotations. So in this specific report on teleworking, this is where we can distinguish what the different possibilities are to work between men and women in different occupations, and how we have had this conciliation in the home and these tasks on being able to cover these needs. Working at home is an aspect that we have definitely analyzed in detail, and is an aspect that we have to continue analyzing. And there I'd like to add something that Aldo had mentioned, which is the availability of information, to be able to look at the detail and to know what the use of time is on behalf of men and women. And in general, that is the information that is regular in the traditional surveys from home. And recently, there is this availability for information. And in this context, I believe that it is worth analyzing and studying. Thank you. Thank you very much, Roxana. Deborah, please. Thank you very much for responding to the question about the coral reefs. Yes, the data is prioritized for the global warmth aspect, and this is what has been published by IPCC. We work on 6 or 7 different years, and the other thing is that now I know that in the group report about the scientific basis of climate change, well, there is an interactive atlas, and this report has been launched in August. And well, one question is, can be useful. And within this work group number 2, we have an analysis, a regional analysis on impact for climate change, vulnerability, and the different options for adaptation. So there is a chapter for North America and Central and South America, and a report of the second group, which is something that we have at the end of February or March. And this is also something where we're going to have an atlas where we can have more regional information. I'd like to thank you very much. Thank you very much, Deborah. And well, we'd like to thank all of the panelists, all of the participants for being here. Thank you for your patience, for your time, for everything, the analysis and information that we have, and the discussion that we've also had today. And this Jubilee in the United States and LATINDAD, we would like to thank all of you. We have the hopes that this is going to be a tool for, as Herman had said in the chat, so that we can generate measures of redistribution that are going to be allowing us to have a different series of policies that can generate a better channel for these special issues, and another series of policies that are going to allow countries such as Latin American countries recovery that is fairer, more sustainable, and inclusive. Thank you very much to everyone. You're going to have the video available on our webpage. We're going to make this available to you. Thank you for the translators, and you guys all have a great day. Thank you.